Now, I thought it might be useful to produce an update on the coronavirus situation. Obviously, there's all sorts of information going around, and it's very important that we follow the official advice and guidance from the Chief Medical Officer and what people are saying from the Department for Health. So I've produced a fact sheet which I shall be handing out in the constituency, and I've put on my website as well. I'm planning to go ahead with surgeries that I've got scheduled in Lancing on Friday, and street surgery at Farmers Market in Shoreham on Saturday morning, and at Starbucks in Worthing on Saturday afternoon as well. I think it's perfectly safe to do that. I might not be shaking people's hands this time, but I want to go ahead with business as normal. And it is really important, I can stress, that we take the scientific advice, and that is what the government is doing. Now, we had the budget this week, and there were a substantial amount of measures and a substantial amount of money which the Chancellor is putting behind making sure that people do not suffer financially from the effect of coronavirus. We've changed the way sick pay can be claimed. You'll be able to get sick notes via the 111 helpline as well, and there's going to be changes in the way benefits are paid for self-employed people to make it easier. There's a substantial number of changes that have been made. There are some things that on the face of it appear not to have been covered, and I've been concerned about making sure that childcare, nursery and others are all covered by this, and I've raised that specifically with the Chancellor too. There are more details on my website about all the measures that are being brought in. In terms of what you do about coronavirus, firstly, you do not panic. We are going to carry on with things as normally as possible. All sorts of things have been happening in other countries, and people saying, well, why don't we close down all big gatherings, why don't we close down schools and universities? If the Chief Medical Officer decides that is a sensible route ahead, the government will take that advice. But there's downsides to all this as well. For example, if we did go ahead and close all schools, as they have done in Italy, as it stands, the advice is that there is a near to zero mortality risk to kids. They do not appear to be affected by it as much as adults. There's a question as to whether they can carry it and pass it on or not. But if we close down schools, it will mean those children would have to be at home, which means that parents would have to take time out from their work, and that would include essential health workers from the hospitals and others who we need to be able to carry on those essential jobs. So it will be a carefully balanced judgment if it comes to that. We're entering a new stage of the coronavirus epidemic at the moment. This is the delay stage. We're obviously not as advanced as countries like Italy, which have been deluged. It's important that we are able to make sure we have the capacity in hospital beds and respirators and others for those who need to be hospitalised. And if we can delay this for further weeks and months, then it will mean we can cope with it much better. So far, I think the National Health Service, fantastic workers within the National Health Service and the Department for Health are handling this very well. I think they're giving good advice, and I think they're doing this very responsibly without causing alarm. Now, just to repeat, the advice still is as important as ever. Wash your hands on a regular basis. Use hand gel sanitizers where you can't get access to washing your hands. Don't get up close to people if you can avoid it, and only if you have been within 2 meters of somebody who then contracts coronavirus and you've been with them for at least 15 minutes, do you need to take action about potentially self-isolating. And if you need to, then you get in touch with the 111 telephone helpline, or you go online to the 111nhs.gov website to get further advice from there. Get the expert, proper, up-to-date advice through the NHS, and we will get through this. And the government is doing everything it can to make sure people can get on with their lives as normally as possible. I'll be handing out my leaflet at my street surgeries, but you can get access to it with all the full details of all the full links by going to my website at timlawton.com.